Thank you for sticking around and listening to American Medicine Today. I'm Kimberly Bonatti, joined by Ethan Euchre.
Happy to be here.
Happy you're here, too.
Thank you.
And world-renowned orthopedic surgeon, Dr. Alfred Bonatti. Right now, around the world, more than 300,000 children are diagnosed with cancer each year. And here to share a very personal story about her own daughter's battle with the disease, Sue Matthews, author of the new book, Paint Your Hair Blue, a celebration of life with hope for tomorrow in the face of pediatric cancer. Thank you for being here, Sue.
Good afternoon. Thank you for having me.
Absolutely. Yes. Very tough personal story. Take us back to that day when your 11-year-old daughter, Taylor, was first diagnosed. How did you know something was wrong? I mean, what led to the diagnosis?
Very few symptoms. She was diagnosed with exercise-induced asthma by her pediatrician. And when the pediatrician gave her an inhaler, albuterol, she went back to total sports. She was completely fine. Snowboarding at high altitude, scuba diving, conditions you wouldn't think if you had anything in your lungs. Okay. And it is my cautious nature, and probably because my mother never took us to doctors, that I always took my 3 daughters to doctors right away. And although the pediatrician rolled her eyes at me, I said I wanted to go to a pulmonologist. So Taylor came bounding out of school. She had just got her bunk assignments for 6th grade camp, leaving her backpack in school, thinking we would be back in an hour. And the pulmonologist took a chest x-ray. She had over 100 metastases in her lungs.
Wow.
Oh, my God.
So to me, that's just mother's intuition. If they were telling you, hey, you know, whatever, it's asthma, it's nothing. I mean, what made you second guess that?
You know what? Unfortunately, or fortunately, I just second guessed most doctors. I think it was because I was raised without doctors, and I always wanted to go to them. I wanted to make sure that, you know, my daughter was okay.
How did you cope with such a diagnosis for your young little girl?
We never went home that night. So it was different than someone waiting for a biopsy. So the shock, the fear, the anxiety, what are we going to do with our other daughters, you know, was incredible. My husband was working down on Wall Street. It took him 2 hours to get to the doctor's appointment. Right. I honestly don't remember that much of the day, but I do remember that we knew we had to team up. He took the decision of telling Taylor she had cancer, and I went home and took the decision of telling my parents and my other 2 girls. And your world is turned upside down. You don't even know what to expect. You have no idea. But one thing we learned quickly is that although Taylor wouldn't really let us be sad, that was just her personality, I could be sad in front of her, but I could absolutely not show any fear or anxiety. She needed to have hope. She needed to have faith. And most little kids, they think mommy and daddy are going to make everything better. And she believed that till the night she died. She passed away in Germany because we were doing an experimental treatment there. And she was on a CPAP, on a breathing apparatus. And she wrote in her notes, Daddy, I'm making it home for her girlfriend's Sweet 16 next week. She always believed she could overcome everything. And that gave her hope and inspiration and let her live the life of the child that she was, full of spunk, energy, fun, love.
You write that your daughter could be a kid with cancer, but not a cancer kid. How important was that to her overall well-being?
Tremendous. She was not going to be defined by her disease. Whatever it would be, going out bald with a hat on, she was still going out with her friends. She said, Mommy, if I'm throwing up from chemo, they're throwing up from drinking alcohol. It's the same thing. I'll fit in. One time she had laparoscopic surgery and her stomach blew up. She insisted on leaving the hospital in a day and insisted on going out that night with her friends. I walked into her room with tears in my eyes saying, you know, there are jeans all over the floor. She didn't fit into any of her jeans because her stomach. She goes, forget it. I'm going out in sweatpants. She just was determined to live life. That's always her personality. But she taught us, rather than us teaching her, that every day, every minute is a celebration. We're only here one time. None of us know how long we have. She was determined as a kid and as she got older into a teenager to have fun.
What was their original diagnosis? I mean, did they give you a time frame to how long you thought you would have your daughter?
Yeah, what stage was she at in that initial diagnosis?
Stage 4.
Already at stage 4.
Yeah, pediatric cancer is generally not diagnosed in stages. It's either metastatic or not metastatic. Wow. So we asked the doctor that day, and she said in terms of stages, she's stage 4.
Wow.
Sure, both lungs were completely metastasized. The primary tumor was between her ribs, which that's why she didn't feel it, because it grew between her ribs. She was metastasized to both femurs and adrenal glands. So the doctor doctor said to us, why don't you just go on vacation for 3 months? She doesn't have long to live. And I said, 3 months. That's what they gave us.
Wow.
She's 11 years old. I said to them, you have got to be kidding me. My daughter was in school yesterday. I'm not going to accept this diagnosis. We have to find a way to treat her. And she lived almost 5 years.
5 beautiful, miraculous years you got with your daughter.
Extra time.
Any parent would say one day you would take.
Now, what are some of the lessons that not only you learned, but that people who read the book can learn, maybe parents that are in the same situation, Sue?
Well, there's a whole section on the back that's treatment tips from a layman's standpoint from parents that had no medical background or no medical background of anybody in the family. Things such as second opinions, what to do when you're having surgery, checking with the anesthesiologist that day because they gave her an antibiotic that she was allergic to. We had a lot of, unfortunately, mistakes, but the thing that stands out primarily in Paint Your Hair Blue is advocate, 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 question, question, question. When you don't get the answer you like, move on and see if there's another solution.
Well, sorry, go ahead, Sue.
No, Taylor was treated in many hospitals in the U.S. and in Germany and London.
Wow. And also, we only have a couple of minutes left, but you talk about how the world of pediatric cancer is like grossly underfunded. Just tell us a little bit about that and your efforts to change some of that.
It is grossly underfunded. All pediatric cancers receive 4% of the National Cancer Institute's budget, with 2 pediatric cancer drugs developed in the last 30 years compared to 182 for adults.
That's ridiculous.
Taylor found that out, and when we found out that her protocol was 30 to 40 years old, she wanted to make a difference. So within 3 or 4 weeks, the help of friends, of course, she founded her own foundation.
Wow.
And it's funny because when she raised her first $100,000, she didn't understand what the zeros meant. It was like I was giving her $10 to go get a slice of pizza.
Right.
But, we've now raised $1.4 million and have results that we've saved lives.
Wow, good for you. And really quickly, what is the title of the book? What does that mean, Paint Your Hair Blue?
Well, that epitomizes my daughter, Taylor, who I still call a pest. When it takes about 2 weeks to lose your hair after chemotherapy, and instead of crying about it and having anxiety, which I was crying and having anxiety, she looked at it as I have 2 weeks. She had gleaming, long, straight hair like every other kid did at that age. She took it as I have 2 weeks to have fun with my hair. I'll cut it in layers. I'll spike it. Blue was her favorite color. In retrospect, we should have dyed her hair blue. The advice she gave to other children was dye your hair pink. If you're a boy, cut it in a mohawk. It epitomizes her spirit. She wasn't going to let cancer get her down or anything, and she was going to have fun in those 2 weeks.
It's a beautiful story. Well, we're very sorry for your loss, Sue. Yeah, Kimberly's barely holding it together over here.
It's very emotional.
She has a young daughter herself, so.
Yeah, thank you. Thank you so much for all the work you do to help pediatric cancer patients. Thank you so much and for sharing this story. I'm sure it's got to be painful every time you talk about it. God bless you, Sue.
God bless you, too. Thank you so much for having me.
You got it. Bye-bye. Once again, the book is called Paint Your Hair Blue, A Celebration of Life with Hope for Tomorrow in the Face of Pediatric Cancer by Sue Matthews.
And it is so true. If you feel in your heart that something's wrong, you should question everything.
Absolutely.
Thanks for listening to American Medicine Today.